Hi, everybody. This is Empowering Democracy. I'm your host, Joe Firestone. Topics for tonight Medicare for All, Medicare Advantage, medical debt, and healthcare spending. Uh, I've got a bunch of articles to go over tonight, and those articles paint a picture, I think, a very interesting picture about where Medicare for All stands, right now. So let's get to the first of these. Let me share the screen. Four of the articles tonight come from Common Dreams. I've kind of been saving them for a while. Is this right? Nope. I'm sharing the wrong article, so please excuse me. I did not pick up the right article, so let me stop the screen and we will try again. Let's see if this is the one. I think it is. So, here's a picture of a panel with Nancy Altman of Social Security Works on your left, Wendell Potter of the Center for Health and Democracy, and Senator Bernie Sanders, independent of Vermont, speaking at the Sanders Institute gathering on June 2nd, 2024 in Burlington, Vermont. Photo is by Dan Esteban, 2024, via the Sanders Institute. And the headline is, quote, "We can get there," unquote. Medicare for All advocates see resurgence in the national movement. Quote, "More and more people are waking up to realize we do not want private insurance companies to be in control of our healthcare system," unquote, said one advocate who attended the latest Sanders Institute gathering. This piece is by Julia Conley, and it was June 5th, 2024. So I've been saving it up for 2 weeks now. At the Sanders Institute gathering in Burlington, Vermont last weekend, U.S. Senator Bernie Sanders repeated the grim facts and statistics about one of these issues he's most passionate about, healthcare, that were no doubt familiar to many of the progressive advocates at the conference. Specifically, Americans spend twice as much per capita as what people in other countries pay for healthcare, with significantly lower life expectancy to show for it. Also, medical debt pushes more than 500,000 people in the United States into bankruptcy each year. That's a very old statistic. It doesn't vary by much. It's the same each year. More than 500,000 people. More than a third of healthcare expenses go not to actual Medicare, but to administrative costs. To administrative costs and profit. Don't forget the profit. The profit is very important. I'm not going to play that here. Don't have time for it. Despite the well-known state of the U.S. healthcare system, and the current political climate in which the fight for Medicare for all has been relatively, quote, quiet, unquote, as one advocate said. Dr. Deborah Richter believes the gathering showed a resurgence in the movement for a government-funded healthcare system is on its way. Growing partisan anger over lack of transparency about healthcare prices. Oh yeah, I had an experience of my own here. We had a situation, okay, where Bonnie fell and broke her hip, and she had surgery, and at the end of that process, we were left with a copay of $1,125. Most people would think that we were lucky that it was only a copay of $1,125. We didn't know where the copay came from. The bill was written in such a way that it just wasn't transparent. It was the hospital bill that was not transparent. It was a $57,000 bill. After insurance took care of most of it, there was a copay of $1,125. Now, we had never had such a large copay from a hospital stay at Kaiser before, but this was the first copay that we got in a Medicare Advantage situation. So we knew that the level of the copay was due to us being under Medicare Advantage rather than under a classic Medicare program. But still, the point is, where did it come from? Where exactly did it come from? Well, we took our bills over to Kaiser and we deciphered it with a Kaiser member services person. And she said, oh, I think I know where it came from. It came from a charge for the room, $225 a night for the room. But Bonnie her stay at the hospital was for 5 days. So it was $225 times 5 equals $1,125. So why had we never had room fees before? Because under classic Medicare, the room fee was absorbed by Medicare. But under Medicare Advantage, the way Kaiser ran its Medicare Advantage program, Kaiser did not absorb the room fee. And of course, in the Medicare Advantage program, it's your Medicare Advantage insurance provider that you are dealing with, not directly with Medicare itself. In that situation, Medicare pays your insurance company and doesn't actually directly cover you. It's your insurance company that's covering you. And what Medicare does is it gives a fixed amount per year per patient, depending on the classification of the patient, for Kaiser or for the insurance company to take care of you. Okay, and so it doesn't pay the insurance company for your hospital stay, doesn't pay the insurance company for your incident. It just pays the insurance company for 1 year to take care of you. If you're in one category, they might give the insurance company $8,000 a year to take care of you. If you're in another, it might be $25,000 or $35,000, depends upon your category. And out of that, the insurance company pays various costs and rakes off a profit. So in our case, we had a copay of $1,125 that we never would have had under classic Medicare. Anyway, the bill wasn't very transparent. That was the point. The huge profits raked in by insurance companies, while an estimated 98 million American adults skip or delay medical appointments to avoid an unaffordable bill, are all pushing people to demand change, according to Richter, who gave a presentation about efforts to bring government-funded healthcare to Vermont. Quote from Richter, quote, Walter Cronkite once said that the U.S. healthcare system is neither healthy nor caring nor a system, unquote, said Richter in the talk. I don't know how many of you recognize the name of Walter Cronkite. He's been dead for so long, but Richter knew his name, which, like the rest of the three-day conference, was live streamed. Quote, and decades later, it's still true, and I think that's the bad news. The good news is that it is possible to cover every single Vermonter, every single American, with comprehensive coverage without spending a penny more than we're spending currently. That is actually misleading. It is possible to cover every single American with comprehensive coverage while spending nearly 50% less than we are spending currently. So Deborah Richter really misestimated all that. The system that costs Americans twice the amount, which people in other wealthy, you can see there it is, twice the amount which people in other countries pay for health care, is spending money not on caring for people, but on administration, said Richter, showing a chart that compared Duke University Hospital Medical Center, the facility with 957 beds and 1,600 billing clerks, with a Canadian hospital with 1,200 beds and just 7 billing clerks. Since 1970, she said, the U.S. has seen more than a 4,000% increase in the number of healthcare administrators, while the number of doctors has risen just 200%. Why is that? Well, we know part of the reason for that is that all those billing clerks are there to participate in the insurance companies denying coverage when they should be taking care of your coverage. At least that's part of the reason why there are so many billing clerks. Okay, discrepancy has helped lead to a system in which insurers are increasingly denying claims to maximize their own profits. I'm hearing from people who are pretty much Republicans and more conservative in their views complaining about Medicare, complaining about the fact that Medicare doesn't cover things. Richter told Common Dreams after her talk, pointing particularly to Medicare Advantage, which is billed as an alternative to traditional Medicare that provides greater benefit, but whose participating private insurers frequently deny claims and overcharge the government, costing taxpayers $140 billion annually. I'm sure that statistic is true, but of course it doesn't mention also charging people higher copays. You get certain supplementary benefits, like some people cover your grocery bills, and some insurance companies do that. Others don't. Some have lower copays for certain things, but as in our case, when you go to the hospital, you might get charged for the room, where before you aren't charged for the room. So, Richter, a primary care physician who chairs Vermont Healthcare for All, said she frequently hears from patients, quote, about having to jump through all kinds of hoops in order to get a procedure or a prescription or whatever. And you're hearing that from pretty much everybody now. Those are all the kindling that we need to get this movement ignited again, unquote. It's the silver lining to having things just crumbling before your eyes. In Vermont and across the country, the crumbling healthcare system is one in which primary care doctors are leaving their profession in droves, fed up with the bureaucracy put in place by for-profit insurance companies that force them to get approval to provide certain services, with insurers placing more value on surgeries and other procedures than on the preventative healthcare management provided by primary care doctors. Physicians are spending their days, quote, having to deal with prior authorizations and having to deal with paperwork to justify that you deserve to be paid for the services you render, unquote, said Richter. Quote again, when you're seeing 16 to 20 patients a day and each one has its own enormous bureaucracy, you can imagine how you end up taking your computer home to do your charts. Medical students are not blind to this and are not choosing primary care, and that's become a catastrophe. As a panel discussion on healthcare for senior citizens in the hospital system, Medicare for All advocate Wendell Potter recalled that while he was working in the for-profit health insurance industry, an executive told him the greatest threat to the business was the possibility that employers who pay for insurance plans for roughly half of insured Americans would begin to see that the industry does little to ensure people get the health care for which they pay an average of $477 per month in premiums. Someone asked the executive, "What keeps you up at night?" And he said, "Disintermediation," said Potter, who worked in communications for health insurance giants Humana and Cigna before leaving the industry to advocate for Medicare for all. Quote, he said that employers in particular would begin to wake up and question the value proposition of big insurance companies as the middleman, but they as middlemen take more and more of the dollars that we spend on healthcare, unquote. Another panel focused on price transparency in healthcare, a cause which Sanders, independent of Vermont, has championed along with Medicare for All to reduce patients' costs within the current system. Along with Senator Mike Braun, Republican of Indiana, that's a surprise. Mike Braun's a real conservative. Earlier this year, Sanders introduced the Healthcare Prices Revealed and Information to Consumers Explained, that is a price, Transparency Act 2.0, Senate Bill 3548, which would require all negotiated rates and cash prices between healthcare plans and providers to be accessible to patients. Yeah, if I had had that when I went over the bill, I would have known exactly where the $1,125 was coming from. Wouldn't have had to go over to the nice person at Kaiser to spend some time with her. It was fun talking to her. She's very nice and all. But I wouldn't have had to have made the trip. I would have just seen where that 1125 came from. Healthcare price transparency has officially been the law of the land since 2021. Oh, it's the law of the land, but it was totally non-transparent in my bill. What do you know about that? Shall I take them to court because they violated the law of the land? Anyway, going on. Explained Cynthia Fisher, founder and chair of Patient Rights Advocate at the gathering. But many hospitals refuse to comply with the price transparency rule finalized by the Centers for Medicare and Medicaid Services under the Trump administration, even suing to block the rule and appealing when they lost the case. More than the hospitals are trying to fool you. They're trying to fool everybody. More than 3 years later, Fisher's organization still sees medical bills, quote, beyond the negotiated rates that are in place now today, unquote, she told Common Dreams. Only 30% of hospitals postall their pricing data for patients to see online, she said. And, quote again, the insurance industry has made the files very difficult for anybody to read and parse through. Yeah, like even a PhD like me, right? Under the for-profit healthcare system, Fisher said, patients become victims of the equivalent of, quote, extortion, unquote, as they're forced to arrange medical procedures without knowing how much they'll cost out of pocket or how much another hospital might charge for the same care. Of course, you don't have time even to consider another hospital. I mean, if you have the emergency people come and get you, how do you know where to tell them to take you? I mean, basically, you want to, if you have something serious, you want to go to the nearest hospital. I mean, there's really no choice in there. Quote, every time we get care, we have to pay by first sign. Quote, we're signing away our right to know those prices up front, and we're signing our rights to say that we are responsible to pay whatever they choose to charge us, unquote. Fisher told the story of one patient in Colorado who was provided only with an estimate of the cost before she got a hysterectomy, with her insurer telling her she was likely to pay a $500 copay and the procedure would cost an estimated $5,000 total. What happened in reality was the insurance company denied the claim. The doctor charged $9,000 out of network, and the hospital had a lien on her home, said Fisher, because she couldn't pay the $74,000 bill. I mean, this is outrageous. I know we got treated pretty well in this situation compared to others because we didn't get a $74,000 bill. Everybody in this room has a healthcare story and knows stories about the problems with having a crazy for-profit system with these middlemen that are completely unnecessary and that raise our costs. Patient rights advocate helped the patient find the hospital pricing file and found the procedure was indeed close to 5,000, and indeed it should have been covered. It took us with her about 4 or 5 months to get that lien off of her home, off her house, but transparent prices empowered her, they saved her, they protected her, and it's happening across the country. The group has started a project called Power to the Patients, partnering with famous musicians as well as artists to make sure Americans know they have the right to know how much their healthcare costs will cost ahead of time. Artist Shepard Ferry designed a mural for the group that has now been painted by local artists in nearly 50 cities across the U.S., including Seattle, Los Angeles, and New York. Proud to see the Power to Pay to PATNTS, that's abbreviation for Patients mural, created by @ObeyGiant and painted by @Gage_Gage_Gage on my stop in Portland. Incredible to see artists working together to prevent dreams being destroyed by health adversity. Hashtag Portland, hashtag Power to the Patients. Power to the patients. I couldn't agree more. Power to the patients. There's 54% of American adults delaying health care to avoid the cost, said Kevin Moore, a co-founder of Power to the Patients. Millions of people across the country have come to believe that, quote, health care is not for them, unquote. Quote, they can't afford it. They don't want to be in a critical moment where they decide, quote, do I pay my rent or do I pay this medical bill, unquote. Morris said at the gathering, quote, people are making a deliberate decision to not seek medical care, to not take these non-discretionary procedures. And when non-discretionary becomes discretionary, we all have a real infrastructural issue in this country. During the question and answer session at the panel on healthcare for senior citizens, healthcare providers and patients alike raised their hands and shared personal stories about the demoralizing nature of fighting to have procedures and medications covered by insurance companies with doctors, quote, stripped of their professionalism, unquote, patients forced to prove to companies that they're required to cover certain services. Potter agreed with Richter that Medicare for All advocates are regrouping, quote unquote, particularly around the issues of improving traditional Medicare by including dental and vision coverage and protecting the program from, quote, creeping, almost galloping privatization by big insurance companies, unquote, but through Medicare Advantage. In our case, by the way, we had classic Medicare until maybe 3 years ago, and then Kaiser stopped offering its coverage, its supplemental coverage, uh, to patients who had classic Medicare. We had the choice of continuing with Kaiser or moving to its Medicare Advantage program. Of course, we wanted to continue with Kaiser because all our doctors were there, all our records were there, and they had given us very good service over a period of years, and we really liked it. So we felt compelled to go into their Medicare Advantage program because it was either that or go to another insurance company. We didn't have any trust in any other insurance company. So we felt compelled to join the Medicare Advantage. We knew it would be cheaper up front, and it has been because our premiums are very small. We also knew that we were waiting for the other shoe to drop where they wouldn't uh, where we wouldn't be able to get a particular prescription we needed, or where we would go to the hospital and yes, we would have a copay where we had almost no copay before. We used to get $100 copays when we go into the hospital for serious things. I mean, we would have $60,000 bills, $80,000 bills, $50,000 bills, and we'd walk away with $100 copays. So we were happy campers. Okay, I don't think there should be any copays, but that's another issue entirely. But we never had a copay of $1,125 before. Okay, anyway, quote, more and more people are waking up to realize we do not want private insurance companies to be in control of our healthcare industry, said Potter, and quote again, Private companies have grown massively over the last several years, and they control so much of their access to care, unquote. From the audience, Ellen Oxfeld of Vermont Healthcare for All rallied other attendees of the gathering. The left gets very splintered, said Oxfeld, and I think Medicare for All is one issue that can unify all of us. I know it's not happening tomorrow, but everybody in this room has a healthcare story. No stories about the problems with having a crazy for-profit system with these middlemen that are completely unnecessary that raise our costs. We can get there is what I'm going to say. What I'm going to say is, can we get there anytime soon? And the reason why I'm going to say that is because even in the last few years when things have been quiet, if you surveyed people and asked about the level of support for Medicare for All, you would get 60 to 70% of people in favor of Medicare for All continuously. And in one famous survey, 88% of Democrats. So why wasn't it possible to get Medicare for All passed through Congress? The answer to that, of course, is so many representatives are bought by the healthcare industry, so that even though popular support is very, very high. Now, this article is sort of assuming that since there's a resurgence of popular support again for Medicare for All, we will get there. What I'm saying is that I don't think popular support is the issue. We've had it all through this period of time. We've had it as far back as I became interested in the healthcare industry in 2008. The popular support was immense for Medicare for All. Why haven't we been able to get it? Because the Congress, largely speaking, is bought. And look at the presidential race, this year. We have a choice of Donald Trump, who's opposed to Medicare for All, Joe Biden, who has said he would veto Medicare for All if it got to his desk. Then there's a third-party candidate with some substantial level of support, specifically Bobby Kennedy. And he has said, even though he thinks Medicare for All is the proper thing to have, it's too heavy a political lift for him to pursue. So once he gets into office, he's not going to pursue it. Okay. The point I'm making is we would have Medicare for All today if we had had a president who supported it from Bill Clinton on. Bill Clinton did not support it. Of course, George W. Bush did not support it. Obama did not support it. Donald Trump did not support it. Joe Biden did not support it. Had we had a president to put pressure on the Congress to pass it through this period of time, we might have gotten it passed. This is especially true in the Obama administration. If he had supported it, popular support for it was very, very high, and Democrats had very large majorities in Congress in 2009 and 2010. If Obama had been for it and wanted to pass it, it would have passed right then. And there. So I think the problem is, first of all, we need to get a president elected who is for Medicare for All and who will fight for it. And people have to vote against people who won't. They have to refuse to put them into the White House. That's the first of the pieces, and that's my commentary on it. But we have a lot more to do tonight, so let me get the second of our articles up. And we're talking, this one is entitled, and this is Picture Medicare Advantages for Profit, Our Lives Should Not Be. A $600 billion swindle. Study makes the case to abolish Medicare Advantage. I sure wish they would. because Kaiser would then just go back to classic Medicare and we'd have the situation we had before. Quote, the time has come to declare MA a failed experiment. That's Medicare Advantage, of course. Write the authors of a new paper. This is by Jake Johnson. And this was, when was it dated? June 10th. Okay, a new academic analysis, also from Common Dreams. A new academic analysis published in JAMA, Journal of the American Medical Association Internal Medicine, details the enormous sums that privatized Medicare Advantage plans have cost U.S. taxpayers in recent years and calls for the abolition of the program, which has been massively profitable for the insurance giants that dominated. Okay, the article goes on. The paper points out that the Medicare Advantage plans have overcharged the federal government to the tune of $612 billion since 2007 and $82 billion last year alone. Well, okay, that's only $2 billion, but do you know how much we spent last year? In other words, what total healthcare spending was in the United States last year? It was roughly $4.3 trillion. So $82 billion is a relatively small piece. The overcharge is a relatively small piece of the 4.3 trillion. Even if we got rid of the overcharge, we still would have been spending what? $4.1 trillion. So we would still be bearing most of those costs. But MA plans, now used by more than half of the eligible Medicare population, utilize a range of tactics to reap larger payments from the federal government, which provides insurers a lump sum for each Medicare Advantage patient. That's what I was saying before. The size of the payment depends on the enrollee's health, which MA plans are notorious for portraying as worse than it is in order to receive heftier government payments. Quote, paradoxically, despite those overpayments, MA plans spend 9% less on medical services than fee-for-service Medicare spends for comparable enrollees, reads a new study. It, and quote again, if MA plans pay less for care, where do the overpayments go? Some pay for supplementary benefits, although plans do not disclose how much they spend on them, and MA enrollees do not get significantly more dental care or incur lower out-of-pocket dental costs than those in the fee-for-service Medicare. Instead, overhead and profit eats up the lion's share. The study authors estimate that MA plans overhead from 2007 to 2024 was $592 billion, which is equivalent to 97% of the taxpayers' $612 billion overpayments to them over that period. Dr. Adam Gaffney, an assistant professor of medicine at Harvard Medical School and the lead author of the new study, said in a statement that Medicare Advantage is a bad deal for taxpayers. Yeah, the other two authors, I'll get to that in a minute. Bad deal for taxpayers, quote, money that could be used to eliminate all co-payments or shore up the Medicare trust fund is instead lining insurers' pockets, said Gaffney, and the private insurers keep Medicare Advantage enrollees from getting needed care by erecting bureaucratic hurdles like prior authorizations and payment denials. Gaffney and study co-authors, Dr. Stephanie Woolhandler and David Himmelstein, co-founders of Physicians for a National Health Program, it says here PHNP, but no, it's PNHP, that's a misprint, argue, based on their examination of Medicare Advantage's decades-long history, that, quote, the time has come to declare MA a failed experiment and abolish it. It sure has. It sure has. It should have been abolished a long time ago. Quote, Medicare Advantage plans have in effect stolen hundreds of billions from taxpayers, unquote. Well, no, because taxpayers don't fund stuff. But of course, after all, what does Himmelstein know? He's a doctor, right? He's not an MMT economist. Says David Himmelstein, a lecturer at Harvard Medical School and a research associate at the consumer advocacy group Public Citizen. Quote, and the private plan schemes also raise seniors' Part B Medicare premiums. Even seniors who don't choose to enroll in Medicare Advantage are subsidizing the private plan's profits. The study's authors observed that the elimination of Medicare Advantage would allow the federal government to use the roughly $88 billion in estimated MA overpayments for the coming year to instead upgrade benefits for all Medicare beneficiaries. Traditional Medicare typically does not cover dental, vision, or hearing services, which often leads people to choose Medicare Advantage plans. Well, Kaiser does have coverage for dental, vision, and hearing services, but by the way, we have to pay an extra $40 a month for that. In other words, that's not part of the Medicare Advantage program. It's a supplement they sell, okay, in order to handle that. Okay, it's interesting to know that they're probably paying for part of that supplement out of the MA payments that come from the government. Quote, a smarter, thriftier way to expand benefits and lower out-of-pocket costs as possible for all Medicare beneficiaries is first we must eliminate Medicare Advantage, double down on traditional Medicare covering all enrollees, and expanded and improved Medicare program. The analysis concludes, quote, that would be a good deal for patients and taxpayers. Wendell Potter, a former insurance executive, has become a trenchant critic of Medicare Advantage, told Common Dreams that he agrees with the study's authors that MA, quote, should be eliminated. Not only has it never saved taxpayers a dime since it was created during the George W. Bush administration, but it has cost us $592 billion over the last 17 years. Thank you, George Bush, because of the high administrative costs inherent in the program and the way insurers have rigged the system to get paid excessively every year, said Potter, president of the Center for Health and Democracy. Quote, the program is so entrenched and the companies have so much political influence over Democrats as well as Republicans through campaign contributions and lobbying that eliminating the program will be a heavy lift, at least in the near term. Potter added, quote, that means that proposals to reform Medicare Advantage that address overpayments and abuses like prior authorization are essential and important for reform advocates to support, unquote. So again, it's a heavy lift to eliminate the Medicare Advantage and go to enhanced Medicare for all. So we have to entertain proposals to reform Medicare Advantage that address overpayments, gain, abuses. But the most that will do is cut costs on the margins, as I indicated. The $88 billion a year, or $85 billion a year, or $82 billion a year that we talked about is on the margins of total healthcare spending, which is running about $4.3 trillion per year now. By the way, I may be out of date a year on that. That $4.3 trillion was from 2022. I don't know what the 2023 total was. I haven't looked it up yet. I should look that up so I have it in my head. So anyway, next piece. Okay. So on the one hand, we have a resurgent Medicare for all movement. On the other, we have a Medicare Advantage program, which increasingly is gypping more and more and more of us because we're being forced into the Medicare Advantage program. Okay, so here we come for the third article. And that third article is entitled okay, here we are. Okay, majority of Americans favor federal action to relieve medical debt. This is a poll. Of course, the Medicare Advantage program, among other things, is leaving Medicare patients with higher debt than they have before. But this article, addresses, of course, the more general problem of all patients who are more likely to be going into debt and who favor federal action to to relieve medical debt. Quote, they don't give you a choice in the hospital. Quote, if you leave, you'll die, unquote, they told me. I didn't feel like dying, unquote. An Alaskan in medical debt said, quote, I don't think anyone should have to go into financial ruin to live, unquote. This is by Edward Carver, June 18th, 2024. It's from Common Dreams. The majority of Americans support medical debt relief, with about half showing strong support, according to a new poll. I mean, what's wrong with the other half? I mean, what? With about half showing strong support. Why isn't everybody showing strong support? What's wrong with people? According to a new poll from the University of Chicago Harris School of Public Policy and the Associated Press, NORC, National Opinion Research Center, for Public Affairs Research. The poll, first reported by the Associated Press on Tuesday, found that 51% of Americans believe it's, quote, extremely or very important, unquote, for the U.S. government to provide relief to people with medical debt, while another 30% believe it's somewhat important. So it's 81% who think it's at least somewhat important. 51% say extremely or very important. Only 19% evidently don't think it's important. That's a small figure for polling, but you have to wonder, what are those 19% crazy? The support for government action comes as a glimmer of hope for the roughly 14 million Americans, 14 million of us, wow, who owe $1,000 or more in medical debt. Oh, that's us. We're in that group. I'm amazed. A common cause of bankruptcy in the U.S., and the even greater number who have medical debt on their credit reports. Oh, yeah. Janelle Williams, I think it's Janelle, how you pronounce that, a 38-year-old retail sales manager in Fairbanks, Alaska, who was saddled with $50,000 in medical debt that makes it hard to buy a house, told the Associated Press that he didn't have any choice about taking the debt on. It was the only way to save his life when he had a blood infection. Quote, they don't give you a choice in the hospital. If you leave, you'll die, they told me. I don't feel like dying, Williams said. I don't think anyone should have to go into financial ruin to live. Last month, 4 progressive lawmakers, including Senator Bernie Sanders, Ro Khanna, the Democrat of California, in the House, introduced the Medical Debt Cancellation Act in both houses of Congress. The bill would prevent the collection of previously accrued debt, create a federal program for canceling debt, and take measures to limit future medical debts. Certain states and cities have already taken action to forgive medical debt, often using funds from the 2021 federal stimulus package. Sanders and Khanna helped launch a Freedom from Medical Debt initiative last year, and the Biden administration has taken steps to relieve the burden of medical debt. Last week, the Consumer Financial Protection Bureau announced new rules that will forbid the inclusion of medical debt on credit reports. That certainly would be nice. A move aimed at preventing debt collectors from using the credit reporting system to coerce people to pay. Well, I'm sure there are many of them who would not pay then. I certainly, wouldn't mind that, but I'm sure the hospitals might. Vice President Kamala Harris came out in support of the new CFPB rules, which are unlikely to be finalized before the presidential election in November. Quote, unlikely to be finalized before the presidential election. Oh, so are they going to drop it after the presidential election? Quote, well, what happens if Trump wins? So then is he going to rescind those CFPB rules or try to do it anyway? Quote, medical debt makes it more difficult for millions of Americans to be approved for a car loan, a home loan, or a small business loan, she said. All of which in turn makes it more difficult to just get by, much less get ahead. That is simply not fair. The new poll, which was released last week, found medical debt relief is especially popular with people who have personal experience with medical debt or billing issues. Wow, what a surprising finding. People who've experienced healthcare fraud favor medical debt relief 66% to 10%, and those with large medical debts relative to their income favor it 56% to 14%. Those are pretty good polling figures. Uh, I'm not going to read from this graph, but there's also strong support for medical debt relief among Democrats, the poll found, with 65% expressing strong support compared to only 31% of Republicans, though other members of both parties showed some support, with only a small proportion deeming the issue not important. Data came from a survey of 1,309 Americans between May 16th and May 21st, 2024. That is a recent survey. The burden of medical debt is disproportionately carried by people of low or middle income, the middle-aged, and Black people, according to the Peterson KFF Health System Tracker. Matt Haskell, 24, of Inglewood, Florida, told the AP that he supported medical debt relief following his own expensive hospitalization. He got a metal flake in his cornea while working on rusty cars and eventually went to the emergency room. The treatment cost him $4,500. I generally think, quote, I generally think it's never anybody's fault when they have a medical condition, unquote, he said. Quote, if they get cancer or a tumor or have an episode from undiagnosed diabetes, it's not someone's fault if they develop something, and now they're thousands or hundreds of thousands of dollars in debt, unquote. Sure, it's no one's fault, but there isn't such a thing as no-fault insurance in this area that covers everything. The government should provide no-fault insurance free of charge so there's no medical debt. Why, I think that's the enhanced Medicare for all bill that's being pushed by Pramila Jayapal in the House and Bernie Sanders in the Senate, and that hasn't had a ghost of a chance of passing because most senators are bought by the health insurance companies and most people in the House are bought by the health insurance companies, and especially the leadership in both houses of Congress, bought by the health insurance industry and by the pharmaceutical industry, bought by hundreds of thousands, even millions of dollars of contributions. That's the truth. Anyway, on to the next piece. Our fourth piece tonight. We're moving through these like a hot knife through butter now. So, this one is called We Need Medicare for All Yesterday, quote unquote. U.S. healthcare spending to hit $7.7 trillion. Quote, the jaw-dropping figures, unquote, said one advocate, highlight the need to move to Medicare for all immediately. They certainly do, because, okay, and listen, the experience of other nations indicates that we could save as much as 50% per year in overall healthcare spending if we passed the Medicare for all bills currently sitting in the House and Senate that get introduced all the time, and then they're simply tabled, they're just sitting there, and nothing happens to them. They're pigeonholed in committee because the leaders don't want to take a vote on them. They don't want to embarrass people because, of course, the people who are embarrassed by the insurance companies, of course, don't want to be embarrassed by the insurance companies, so they don't want the leaders to take a vote, so the leaders don't take a vote. They never get to the floor. We can't get them to the floor. A federal analysis released this week projects that U.S. healthcare spending is set to rise to $7 trillion by 2032 and account for nearly 20% of the nation's economy. findings that single-payer advocates described as yet another indictment of the country's for-profit system and further evidence of the need for Medicare for all. The Centers for Medicare and Medicaid Services, CMS, Office of the Actuary, said Wednesday that it expects national healthcare expenditures to outpace U.S. economic growth over roughly the next decade, quote, resulting in an increase in the health spending of share of GDP from 17.3% in 2022 to 19.7% in 2032. Now, it was that 17.3%, by the way, that corresponded to the $4.3 trillion, okay, that I quoted, okay, before. Okay. Of course, we're going up from that $4.3 trillion to $7.7 trillion, okay, because, of course, the GDP of the country, okay, is going to be going up. And, okay, so even though we're getting that relatively small increase from 17.3% of GDP to 19.7% of GDP, in dollars, it's an enormous difference. It's almost the doubling, right? The CMS analysis showed that U.S. healthcare spending grew at a rate of 7.5% last year, that's 2023, with overall expenses reaching $4.8 trillion. So I didn't have that $4.8 trillion figure off the top of my head. CMS says it projects healthcare spending will rise by 5.6% annually over the coming years, with overall spending reaching $7.7 trillion in 2032. Yeah, we could really stem the rise of that because based on the experience of other nations, if we have Medicare for all, we have a good chance of cutting our expenditures by 50%. Instead of being 4.8 trillion, just last year, it would have cost only 2.4 trillion, okay, last year. So even if it were rising by 5.6% annually, of course, that $7.7 trillion would only represent a rise of to $3.8 trillion or something like that. $3.85 trillion, I guess, off the top of my head. So, I mean, there would be a big savings, huge savings. If there's a savings of $3.85 trillion over a decade, that amounts to savings of $38.5 trillion, doesn't it? Robert Weissman, president of the consumer advocacy group Public Citizen, said in a statement Thursday that the coming surge in healthcare spending has, quote, nothing to do with improving care and everything to do with price gouging, monopolization, and wealth extraction by insurance corporations, big pharma, and for-profit hospitals, unquote. Completely right. Despite spending more on healthcare per capita than any other rich nation, the United States consistently ranks last among its peers in health outcomes. Skip those graphics. Weissman on Thursday pointed to an academic analysis published earlier this week in JAMA Internal Medicine, detailing the massive costs of Medicare Advantage. Yeah, that's the Gaffney, Himmelstein, and Woolhandler study. Again, the same study that showed overcharging of $612 billion since 2007. We have known for decades that healthcare costs in the U.S. are out of control. The jaw-dropping figures from CMS highlight the need to move to Medicare for all immediately so that we can finally start to make healthcare more affordable for taxpayers while ensuring everyone in America can access the care and medicines that they need. So here are these conservative Republicans, they're always moaning and groaning about the debt, and we're spending more than we have to, and we need to economize. And a simple way to economize would be just to go for Medicare for all. We could cut our expenditures Well, if they were 4.8 trillion, we could cut them by 2.4 trillion a year. Right now, all we'd have to do is pass the Medicare for All bill. But of course, the Republicans care more about uh, not giving people Medicare for all. They care more about the profits of the insurance companies than they do about trimming the debt that they're always talking about. They're always doing, debt terrorism. There are various reasons why I think that's all BS. But apart from those reasons, they say they care about the debt. It's the central issue. Even Bobby Kennedy says it's a central issue. Yeah, but Bobby Kennedy also says it's too heavy a lift for him to fight the Medicare for all. He could save $2.4 trillion a year if he passed the Medicare for all bill. But it's too heavy a lift for him to fight for, right? But he's got to do something about the debt. The debt is so high, it's terrible. We got to do something about it. Well, what does he think he's going to do something about it? Is he going to cut health care benefits altogether? Is he going to cut housing benefits altogether? Is he going to cut other parts of the safety net altogether? Is he going to raise taxes sky high? What's he going to do? Studies have repeatedly shown that transitioning to Medicare for all system, as proposed by Senator Bernie Sanders and more than 120 others, will save the U.S. hundreds of billions of dollars a year. No. The advocates for Medicare for all drive me crazy because they always are underestimating the savings because they don't want to be accused of being somehow faulty, in their estimates and fighting with conservatives over numbers. Screw that. The experiences of other countries that have similar Medicare for all system, the average of the OECD countries is 10% of GDP. That's what we should be spending, 10% of GDP, the average of all nations that have a universal healthcare system. We shouldn't be spending more than the average. Okay? If we were spending that 10% now, well, we wouldn't save exactly the 50%, but we'd save something like 40% or so. And if we were as efficient in managing Medicare for all as we are in managing the Medicare system itself, the classic Medicare system anyway, not the Medicare Advantage system, then we would save that 50% I talked about. So, people who estimate how much we would save, the progressives are too conservative about their estimates of what we would save. I'm telling you, we would save in the trillions of dollars, not in the hundreds of billions of dollars a year. You keep that in mind. That's the truth. Peer-reviewed research published in 2022 estimated that more than 338,000 coronavirus-related deaths could have been prevented in the U.S. if the country had a single-payer system that guaranteed coverage to all people as a right. Quote, other countries spend far less per capita on healthcare while guaranteeing coverage and providing high-quality healthcare. Yeah, higher than ours, unquote. Weissman said Thursday. It is time that we do the same. So, yeah, it's time. And the final article that we're going to go over here tonight, then I'm going to sum it all up. And there we go. This is from Truth Out. New Biden rule would ban medical debt from credit reports. That was also covered in the other article. However, critics point out the new rule fails to address the root of the issue, access to affordable health care. We don't need or want access to affordable health care. There's a Democratic Party bias here from people who don't want to pass a Medicare for all bill. We don't need health care that's affordable. We need health care that's free at the point of service. That's what we need, and we can afford that. There's no problem with affording that because it would cost, as I've been saying, 50% of what it costs now. This article is by Dariana Davis, the 19th. This is on June 12th, 2024. Uh, anyway, there's a picture of Kamala Harris who's emerging from a background of blue drapes wearing a white suit with an orange blouse. She decided after she got creamed, okay, during the presidential debates, the primary debates in 2020, she got creamed by Tulsi Gabbard, who was wearing a white suit while she was wearing a organization man gray suit. Okay, for the debates. And basically, Tulsi took her to the cleaners. So she decided now that she was going to wear a white suit with an orange blouse. Could I have refused service? Could you have refused service from the hospital? No way. I mean, you couldn't possibly refuse service. If you were moved in the slightest way, you were in total pain. How could you have refused service? I mean, you couldn't have refused service. So there's Kamala Harris, looking rather beautiful, if I might say. Vice President Kamala Harris arrives to speak at a campaign event for Maryland Democratic Senate candidate Angela Also Brooks on Gun Violence Awareness Day at Kentland Community Center on June 7, 2024, in Landover, Maryland. Oh, by the way, Angela Also Brooks has a tough race ahead of her because she's being opposed by Larry Hogan for the Senate. Larry Hogan was an extremely popular governor in Maryland, and he's a Republican. It's important that Also Brooks win that seat because otherwise the Republicans might take over the Senate. They have a good chance to take over the Senate anyway. But going on, Vice President Kamala Harris on Tuesday announced a new effort to ban medical debt from credit reports, something that would ease a burden that falls most heavily on women and black people. Oh, play a little identity politics in this article. Quote, medical debt makes it more difficult for millions of Americans to be approved for a car loan, home loan, or a small business loan, all of which in turn makes it more difficult to just get by, much less get ahead, and that is simply not fair, especially when we know that people with medical debt are no less likely to repay a loan than those without medical debt, unquote, Harris said. Good, that's a good one. Quote, no one should be denied access to economic opportunity simply because they experienced a medical emergency. Right, and no one should have to owe the medical debt. I don't care whether it's on their credit card report or not. They shouldn't have to owe it simply because they experienced a medical emergency. Federal efforts to remove medical debt from credit reports began last fall after Harris announced the Consumer Financial Protection Bureau would take the first steps to create rules. This is about the CFPB creating the rules, so we'll sort of scroll through it. Other federal efforts to curb medical debt, including the No Surprises Act, which took effect on July 22nd, requires private health care insurance to cover most emergency services, emergency care, and non-emergency in-network services, and prohibits medical providers from billing patients more than in-network cost sharing. So that's an interesting bill, but I think one of the purposes of the No Surprises bill was also to stop people from getting balance bills after they get out of the hospital. Unexpected balance bills, of course. We did get an unexpected balance bill. The rule change could lead to more people being able to borrow money. As CFPB Director Rohit Chopra said, it would give lenders more accurate and predictive information about the borrowers. 15 million Americans who would benefit from this credit reporting change would see their scores rise by an average of 20 points for mortgages alone. We estimate this could lead to approximately 22,000 additional home loans each year. Our action today is an important step toward reducing some of the unnecessary costs of getting sick in America, unquote. The nationwide credit reporting agencies, which are Equifax, Experian, and TransUnion, removed medical debt under 500 from consumer credit reports as of April 2023. However, this April, the CFP-related research found 15 million Americans still have medical debt on their credit reports, particularly those in the American South and low-income communities. A March 2022 report from the CFPB found that Americans were harboring $88 billion in medical debt. Okay, a Kaiser Family Foundation health policy research analysis published this year based on a 2021 National Survey of Income Program Participation found that 20 million people owed a collective $220 billion in medical debt. The analysis found that 13% of people with disabilities reported having medical debt, compared with 6% of those without a disability. It found that non-Hispanic Black people carry more medical debt than other racial and ethnic groups, and women carry more than men. A separate analysis found that 14% of people who gave birth in the last year and a half reported having medical debt, compared with 7% of those who did not. Maybe that's one reason for that, is that the cost of giving birth has gone up higher in the last year and a half. Since we know that Black adults and women are more at risk of having medical debt, then I would expect this policy would benefit those groups, said Cynthia Cox, KFF president and director of the Foundation's program on the Affordable Care Act, which examines healthcare coverage, cost, affordability, and accessibility. Undue medical debt. What's undue medical debt? I think $2 is undue medical debt. The nonprofit formerly known as Rest in Peace Medical Debt, RIP Medical Debt, that contacts hospitals and healthcare systems requesting they sell or donate portions of patients' debt and pay undem. The nonpartisan public opinion research firm surveyed over 2,600 adults in August 2023, 229 of whom were Black women. Among Black women, 27% said they have delayed or said no to health services out of concerns over acquiring medical debt. The study from the American Cancer Society published in March suggested medical debt is associated with worse health status, more premature deaths, and higher mortality rates at the county level in the United States. Yeah, debts place great stress on people, generally speaking, and it's no wonder. I think this not only holds for medical debt, but for debts of other kinds. There are more premature deaths and higher mortality rates. 2022, YouGov, a research data and analytics technology group, reported that 66% of Americans supported government relief for medical debt. Eva Stahl, the vice president of public policy and program management at Undue Medical Debt, attributes the support to the fact that it can impact anyone. It's not a debt of choice, it's a debt of necessity, because there's a general consensus about that. It's not really a partisan issue, she said. Well, if it's not a partisan issue, then why are there more Republicans who are not concerned about it? Stahl said they have gotten interest from legislators across the nation, even in the South, with some jurisdictions in Texas and Kentucky showing interest in erasing residents' medical debt. Some state-level efforts to erase medical debt for state residents have either passed or been proposed, some in partnership with Undue Medical Burden. In June 2023, Colorado became the first state to prohibit medical debt from being included on residents' credit reports. Similar legislation was passed this year in Connecticut and proposed in New Jersey. Last year, Connecticut state legislature approved a budget that would allocate $6.5 million in American Rescue Plan ARP funding toward erasing medical debt for residents whose medical debt is 5% of their income, or whose household income is up to 400%, of the federal poverty line. Well, that sounds good. Why don't we do it all over the country so we can get it here in Virginia too? Earlier this year, Arizona Governor Katie Hobbs, a Democrat, denounced efforts to use $30 million of ARP funding to cancel medical debt for up to $1 million. Oh, she announced efforts. I shouldn't say denounced. She announced efforts to use $30 million of ARP funding to cancel medical debt for up to 1 million Arizonans using similar criteria as Connecticut. Both states partnered with Undue Medical Debt. To Stahl, removing medical debt from credit reports has limitations. Quote, it's an action that is helpful, but it's not getting it at the root, which is, quote, again, that people don't have access to affordable, high quality health care, unquote. Stiles said, and said, quote, even if you ban medical debt from credible reports, which is important, worthy exercise, people still have unpaid medical bills. Patients will still feel the stress of having debt collectors call them several times a day, asking them when they're going to pay their medical bills, or they may get into payment plans they can't really afford. The senior administration official said public comments are being accepted through August 12th. They expect the rule to be finalized early next year. They're so stupid not to finalize the rule before the election. Don't you think? That's just utter stupidity. Okay, what have we found from this examination? What is the big picture? Well, of course, the big picture is obvious. The big picture is that we need Medicare for all yesterday. We need it yesterday. 70% of Americans want Medicare for all yesterday. Why can't we have it? There is a resurgence of support for it. Does that mean we're going to get it sooner? Well, I'll tell you, folks, we're not getting it from Joe Biden, and we're not getting it from Donald Trump. And if either of those are elected, then we won't have it for at least another 4 years, but following the election. Okay, in other words, the earliest we could possibly have Medicare for all, in spite of the resurgence, is 2029. That's the reality. There is something we can do to change that particular reality. But if we just flatly accept the choice of Joe Biden or Donald Trump, then the earliest we're going to get this is 2029, in spite of any resurgence of support. There's no resurgence of support that can get us this, because the presidents and the leaders in Congress, of the House and the Senate, because they're bought by the insurance companies, are opposed to it, and they will prevent a floor vote in both houses, okay, of Congress. Now, that article on the resurgence of support doesn't recognize that particular reality. It holds out hope that is not there for us to get this. But there is a way we can get it. And there's only one way, okay, that we can get it. And that way is through Dump the Corruption. People who watch this stream know that we can start, okay, a Dump the Corruption movement. What would a Dump the Corruption movement do? First, let us remind ourselves of the centerpiece of a Dump the Corruption movement. Oh, I got a whole bunch of comments tonight, so we'll certainly go through those. But let's look at, of course, the Dump the Corruption rule. I got it somewhere here. There it is, the rule. The rule: vote against every candidate except those who won't take money from wealthy corps, PACs, or party committees, and who repudiate all super PAC support. That includes carry committees too, because carry committees are a combination of a super PAC and a PAC. So, if everybody voted this way in the election of 2024, guess what would happen? Every congressperson would be defeated. I say that based on a survey of 205 House representatives and Senate people. Every one of them, if they were running in 2024, which not all the senators are, would have been replaced if people used this particular rule in 2024. Okay, it's guaranteed that everyone in the House of Representatives would be replaced if you followed this particular rule, and 1/3 of the senators would be replaced. Okay, this rule applies not only to incumbents, but to every candidate. So that would mean also, in other words, there are more Democratic senators who are up for re-election, okay, this year. They would be replaced, but the important point, okay, to note is that all their Republican opponents would also be replaced. In other words, they would lose also. Only third-party candidates taking small donations would win election this year. All the major party candidates would be defeated because they were all taking big money of some sort. Now, guess what? Since all of those taking big money, including big money from the pharmaceutical industry and from the health insurance industry and from all the healthcare industrial complex, okay, since all those people would be replaced and only the small donation people would be in, then the result would be that we would have a House that would be quite willing to pass a Medicare for All bill because on the average, 70% of their constituents would be for it. And there wouldn't be any of their donors against it. So we could get a Medicare for All bill to the House floor and through the House. Oh, by the way, Hakeem Jeffries, who is, of course, opposed to Medicare for All, well, he wouldn't be anymore. He would be defeated. There would be a new leader who wouldn't have taken any big money from the healthcare industrial complex. A new leader who's unknown right now. Probably some Green Party candidate. Similarly, there would be a new majority leader of the Senate, most likely. And because 33 of the senators would be people who wouldn't be beholden to anybody. And they would be in favor of electing somebody to lead, okay, the Senate who is not opposed to passing a Medicare for All bill. Who that would be, I don't know. One possibility is maybe Jeff Merkley would be the majority leader of the Senate. Or Bernie Sanders might become, the majority leader of the Senate. But I'd have to say probably not because I guess Bernie Sanders wouldn't because I think he's running this year and he is taking some big money, so he would have to be defeated. But I don't think Jeff Merkley is running this year. So he would probably get to be the majority leader of the Senate. And he's for Medicare for All. So likely he'd put a Medicare for All bill on the floor. And between the 33 new people coming in and another 18 of the Democratic senators, and maybe many of the Republican senators too, because you know what? The majority of Republican voters are in favor of Medicare for All. Guess what? What a surprise. A majority of Republican voters are in favor of Medicare for All. So the Senate would probably pass a Medicare for All bill. And guess what? Donald Trump would not be president of the United States because applying this rule, you'd vote against him. Joe Biden wouldn't be president of the United States because applying this rule, you'd vote against him. So who would be president of the United States? It would be third-party candidates taking only small dollar donations. That comes down to people like maybe Cornel West or perhaps Jill Stein or perhaps a Libertarian Party candidate. I don't know. I leave that choice, to the voters. I'm just saying, vote against every candidate who is representing donors and will not represent you. If you get people in there who will represent you, then it's very likely that a Medicare for All bill will immediately be passed in 2025. If you favor Medicare for All and you think it's really important, you should vote using this rule because it will get you Medicare for All in 2025. So that, my friends, That, my friends, okay, sums it all up. All those articles on Medicare for All that suggest that maybe we have a chance because there's a Medicare for All resurgence, they are sadly mistaken, okay? Because no resurgence will get it through. But dump the corruption will get it through. We need a dump the corruption campaign to come alive and to spread across the whole country. That's what we need. If we don't get it done, we're wasting time with Medicare for All. We're wasting time with the Green New Deal. We're wasting time with so many good things we can't even begin to talk about them. We got to get the donors, representatives out of Congress, and that's everybody. Over the next 3 elections, we got to get everybody taking big money out of Congress, out of the House and out of the Senate. No mercy. No mercy. They are leftovers from a corrupt system. We want to get rid of the corruption. We got to get rid of them. By the way, once we get rid of them, we'll also be able to pass laws prohibiting contributions from all of the organizations mentioned in the rule. We'll be able to prohibit all those contributions. We'll be able to prohibit donations of $200 or more. Why would we be able to do that? Because we be able to pass campaign finance laws that prohibited large donations. And we could stop the Supreme Court from interfering by using Article 3, Section 2, Clause 2, the exceptions clause, in order to prevent the Supreme Court from judicially reviewing this campaign finance laws, these campaign finance laws. Also, just to make sure this is all tight, we could pass constitutional amendments in both houses of Congress prohibiting campaign donations of $200 or more. Well, we could pass free education. Barney says, yes, we could pass free education at every level. We could pass all kinds of great things. Well, the Green New Deal itself has all kinds of great things in it. Just look at Bernie's platform in 2020. All those measures that constituted the Green New Deal could be passed. It would be a new day here in the United States. It would be a new regime here in the United States. It would be a new political system here in the United States. And Steve Wolfbrand says, hello, everybody. Robert Copeland says, I believe healthcare costs could even be lower than what they are saying because of Medicare for All. Oh, yeah. Steve Wolfbrand says, at least you had insurance. I hope Bonnie is doing well. Bonnie is doing very well. She is back. Before the accident, she was walking with a cane. Now, after the accident, she is again walking with a cane. There's been no difference. She's a little less steady than she used to be, but the strength in her hip has to come back. But that will come back with continuing exercise. She's only about 2.5 months away from the operation thus far, but she's been making fine progress, and we are quite happy. We are fortunate, very fortunate. Jeff Denton says, oh, take care of you, all right. That word provider, health insurance administrator, does not provide anything but a bigger and bigger bill when you already pay something ridiculous, Robert Copeland said. That should be not due to Medicare for All as how many people go to the hospital due to black mold where they live at or other preventable health care issues. Yes. Jeff Denton says, hi, Steve, Joe, they're trying to call what nurses and doctors, and they're just trying to call everyone providers because they're literally replacing the doctors and nurses with administrators. Yes, Jeff. Providers reminds me of that episode of Star Trek where Captain Kirk and Chekhov were made slaves by the providers. Thank you. Jeff Denton says, hi, Robert. Robert says, since AB 2200, better known as CalCare, failed in the state assembly, I'm going to work on passing the Justice for Renters Act, okay, until uh, 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 election day. Robert Copeland says, hi, everybody. Steve says, hi, Robert. Steve Wolfman says, the average person can't figure all this out. Andy Candy says, hi, Joepedia. How are you feeling? You sound spunky. I say that with admiration. Andy Candy says, Andy Candy is really April, says, hi, everyone. And she says, gotta rewatch shared ND stuff. Thank you. Jeffrey Denton says $5 trillion. Yeah, $5 trillion now. It's already reached. It was $4.8 trillion last year. It's already reached $5 trillion for this year. It was 4.5 trillion in 2022, as per Dr. Joe Jarvis. Now, maybe it was. I'm not going to contest with Joe Jarvis. I haven't been studying the statistics that closely lately. Steve Wolfbrand says, hi, April. Jeff Denton says 4.5 trillion 2022, as per Dr. Joe Jarvis. Robert says, since I came in a few minutes late, did Joe talk about upcoding, which raises healthcare costs for the average person? I did say things which imply upcoding, yes. If my friend didn't have Medicare, she would have had to pay a fortune when she got hit by a car just by crossing the street. Yeah. April says, and all the billions for Israel and Ukraine, but ain't a heavy lift. No, it ain't a heavy lift. I mean, because war is big business for us. I mean, after all, war is jobs. War is, long story short, hashtag dump the corruption and feel the heel. Bobby didn't qualify for the fake debate, so he can complain about that all summer. But what Bobby has to do is change many of his positions. He's getting good publicity out of the fake debate. If the fake debate turns out to be a slaughter for the two guys, if they both look as terrible as I think they're going to look, okay, in the debate, then people are going to wish that Bobby was in the debate, and they're going to make a stink about it. Uh, but Bobby's got a lot of things wrong with him, as I've gone through already, and I'll go through again pretty soon, not in this particular stream, though. Robert Copeland says, Joe, a lot of politicians are hypocrites who don't care about the people. That includes both Democrats and Republicans. It does. Jeff Denton says, we know the answer, Joe, literally a tax cut for the middle class, like Dr. Kelton says. The answer to what? I mean, sure, I love a tax cut for the middle class. That's great. But I think we need a federal job guarantee a lot more. I never liked the Kamala Harris when she was state attorney general or she was in the U.S. Senate. Not me. I think she's a mean girl. African American, average American pays over $13,000 a year for health insurance. But if you double 2.9%, if you double 2.9% Medicare deduction to 6%, someone making $100,000 a year would be spending $6,000 instead of $12,000. Well, that's an interesting statistic. Steve Wolfbrand says Willie liked her. Oh yeah. Downtown Willie Brown. Yeah, he did like her. April says, why doesn't the fire sector push for erasing medical debt and free medical care so people can buy their houses and insurance? Lisa Theobald says, hello, folks. Hi, Lisa. Just got here and need to go back and watch. I had a problem developing my soup. I'm developing your soup. Steve says, hi, Lisa. And Lisa says, hi there. So, okay, folks, thank you for coming. I am finished for now. I got to hightail it over to Dee to help her out. Okay, that's, of course, around the world with Dee and friends. Okay, I will see you there. I hope you follow us over there, Lisa. There's usually some good stuff on Israel, okay, and Palestine, and they most probably will be tonight. And so I hope we'll see you over there. Anyway, folks, I hope we'll see you all over there. And I'm going to end this now. And Lisa said the flavor was doggy. Uh-oh. Okay. Okay. Good night, everyone. I'll see you tomorrow. Oh, by the way, I'm going to have an IR show tomorrow, and it's going to be great. So Lisa says, on my way.